I'm Dr. Stephen May. I'm the medical director here at Sullivan County Regional Health Department. And I was asked just to come and share how some of our teams are working together. We all know about the first international travel associated of COVID-19 that we've received in our county. The important thing that we need to share is, number one, there is no evidence of any type of community transmission at this time, and that is a very important fact. But we are working with many of our partners and our stakeholders. That includes our school systems, working with fire, police, EMS, our county government, in sharing this type of information. The CDC has come out with great guidance documents for a number of different public sectors, and one of those includes preparation for school systems and how they should respond in working with your public health department as far as continued operations and infection control principles. So once again, I will stress that our major focus is on prevention. That includes hand washing, covering a cough and sneeze, keeping your hands washed, and then the concept of social distancing. This is important for all the respiratory viruses, just not for COVID-19. So that includes the 6-foot droplet rule. Try to maintain 6 feet between each other if you can. 3 feet is not as good, but it is now being deemed as acceptable. And then as this disease progresses, or should it progress and become community-wide in our spread, then we'll need to talk about limiting congregated settings and limiting those types of activities. But at this time, that is not the case. We do not have any community spread. We only have the one individual case associated with international travel.
Can we get a status update on that patient? You said yesterday that he's actually in self-isolation.
Yes, self-isolation doing well, and we are in the process of conducting a contact investigation at this time.
And would you mind confirming to us that he was an international traveler but did not fly through Tri-Cities Airport?
That is correct.
That's right, okay. And can we get any word as to which part of the county he lives in?
No, I can't.
No, okay.
As far as the risk to schools right now, how would you describe that level of risk?
I'm a whole lot more worried about the flu and the other respiratory viruses. That's what's really circulating at this point in time. If we start to see community transmission, then at that point I think our tactics may need to change.
What has your communication been like with the school officials here today?
I work with all of them on almost a daily basis, especially with the school health nurses. I have a very close relationship with all 3 systems.
Dr. May, you mentioned yesterday you have a team working, just answering phone calls. Can you mention that phone number that you have available and what that operation is like?
Right, we've got 2 or 3 ways to get information. First is through the www.cdc.gov. Also, you can go to tennessee.gov/health, and we all have big sections of lots of information, frequently asked questions that you can obtain most of the questions that you'll want answered. We do have a phone room that is operational at this point in time. It's been mildly busy this morning, but it seems to be settling down. But you can call our health department at 279-2777. We also have information on our website, www.sullivanhealth.org. And that's places that you can find lots of good information. We also work with the Tennessee Department of Health. We have a clinician's hotline that we can work with local physicians that may have questions or inquiries for specific testing.
And your thoughts, Dr. May, on the World Health Organization calling the coronavirus a pandemic?
Well, I think we all knew this was coming. We've been following the dots now for weeks. We now know it's in multiple different countries, in those countries and in parts of our countries with community spread. But at this point in time, it has not reached our community. Yeah, I think you all were gonna plan on just doing some, if you need to talk